We stand closer than ever to making it possible for every American to afford to live a healthy life. Never have we been so close to reforming America's broken health insurance system. We're not over the finish line, but we would never have gotten this far without the support of doctors, nurses, medical professionals who know we need action.
America has the best health care in the world if you can get it. But for far too many people, access to care is out of reach because they lack insurance. And this is just not acceptable to physicians who provide high-quality care in an often fragmented system that doesn't work for them or their patients. After a close and careful review, the AMA is pleased to announce its support for passage of the amended Health System Reform Bill.
This is an historic moment, not only because of the legislation that's about to be passed in the Senate, but also because of the statement we just heard.
I suspect if you could only have one organization or group of people to support this bill, the choice we probably make is the one you're hearing today. While it's important to have other organizations be supportive, there's nothing more fundamental when you get right down to this than the relationship between a patient and their doctor. That's at the most fundamental level. Whether or not you have access to that doctor, whether or not you're going to have the resources to be able to compensate that doctor for his or her services. And so of all the organizations and individuals and groups that have supported this bill, I rate this one as the most important because it speaks to that relationship between patients and doctors.
Specifically, with regard to doctors, I want to emphasize that this bill will enhance the doctor-patient relationship in many ways. For example, by cracking down on health insurance company abuses, we're going to reduce the opportunities for corporate bureaucrats to come between the doctor and the doctor's patient. This bill will reduce administrative requirements and paperwork, again, freeing up doctors to practice medicine and to focus on their patients rather than on paperwork. This bill will significantly increase the number of primary care doctors, especially in rural areas and other underserved communities. We do this by greatly expanding the presence of community health centers and increasing investments in the National Health Service Corps. We also create a rural health care professional pipeline, which give increased training opportunities to health professionals working in rural areas. And I can't emphasize enough how revolutionary it's going to be to transition from our current sick care system to a true health care system, one that focuses on preventing chronic disease and keeping people out of the hospital in the first place. That's what doctors want to do, help people stay healthy.
Passage of the Patient Protection and Affordable Care Act by the Senate will bring us close to the finish line on health system reform.
America's doctors have made the right diagnosis and they've offered the right prescription. Pass the health care reform bill.